Hello, Assalamu alaikum. Is my voice clear?
وعليكم السلام دكتور. Yes, clear.
Okay, thank you. Okay, so anyone willing to take the scenario?
Me? Yes, sir.
Okay, who is this?
Azhar.
Dr. Azhar. Okay, 3 minutes to prepare and then we will start. Okay, time up. Ready?
Yes, sir.
Yeah, start please.
Hi, my name is Dr. Azhar. One of the doctor today here. Am I talking with Miss Amelia John?
Yes, Dr. Amelia.
Okay. Miss Amelia, we are here to discuss with you about your health condition. Is that okay with you?
Sure.
Okay. Miss Amelia, can you tell me what do you know so far about your condition?
Yes, Doctor. I was brought to the hospital after I lost my consciousness. I felt dizzy, sweaty. My heart was racing, and then I collapsed to the ground. I was brought to the emergency department. However, I feel okay now. And please let me home, Doctor.
I'm very sorry to hear about that, Miss Amelia, about your health condition. And can you tell me what's your expectation from today's meeting?
I expect you to discharge me home, Doctor, please.
Okay. I highly appreciate your concern. Miss Amelia, as you have mentioned that you were admitted due to this severe episode of this low blood sugar in your body. So we have done some blood test, and we found that there is some
Doctor,
medicine you
please,
have.
I would like to go home. Is this clear?
I appreciate your concern, Miss Amelia. Can I ask why do you want to go to home at this time?
Doctor, you invited the mood doctor to see me without even taking my permission. This is totally unacceptable, doctor. Please, I would like to go home. Give me the paper, I will sign, okay, and then I will go. I would like to go home.
Miss Amelia, I highly appreciate your concern, but in the situation, as you have mentioned that we are involving the mood doctor. Actually, in this condition, we are usually involving our team of doctors to support the patients. So, can I ask a few questions if you don't mind?
Yes, please go ahead.
Okay. So, let me explain you what the situation first, if you don't mind.
What situation, doctor?
Yes, Miss Amelia, we have run some blood test, and the reports has revealed that in your blood there is a increased doses of concentration of some medicine known as a gliclazide, which is usually used to control the high blood sugars in the patients. So I want to ask, did you take this medicine intentionally or unintentionally?
I didn't take it, doctor.
Okay, I highly appreciate your concern. You didn't take at all, right?
Yes.
Okay. Is there anyone else at your home taking this medicine?
I don't know.
By maybe my mistake, you have taken this medicine?
No, doctor, I didn't take it.
Okay. And is there anything else which is bothering you in this hospital to stay with us?
Yeah, doctor, I just explored. I just mentioned to you, okay, but you didn't seem that you are caring in any way to know. I did tell you that I am angry because you invited the mood doctor to see me without my permission, which for me is it's totally unacceptable, doctor. So please give me the papers, I will sign and go.
Miss Amelia, I highly appreciate your concern, and we invited the mood doctor because this is a situation when we are involving our team of doctors. He's to help to the patients. Sometimes they are just talking with the patients, and sometimes they are giving some medicine to calm down the patients. But in your case, I think we need to discuss with you, if you don't mind.
What do you mean medication to calm the patient down? Do you think I'm mad, doctor?
Ms. Amelia, I highly appreciate your concern. I didn't mean that about that. And sometimes when there is a bad mood of any person, so we can sit together and we can discuss about if there is something bothering them at home or at workplace. So, Ms. Amelia, can you tell me, is there anything going not good in your life at the moment, at
Like what,
workplace
doctor?
or? Sorry?
Like what, doctor?
Like, is there any stressful work at home, stress at home or at work? If you don't
Yeah,
mind
just
to.
like normal. Just like normal, doctor.
Okay. So, Ms. Amelia, actually, the medicine which we found in the blood, it is causing this symptom which you had actually, and it is, very dangerous when there is large doses are found in someone
So,
blood.
doctor, do you promise me that you will keep it secret? You will not tell anyone?
Yes, Ms. Hila, you should not worry about that. You can talk to me, and it will remain confidential between us. Please tell me what's going on with you.
Yes, I took the medicine, doctor. However, you shouldn't have involved the mood doctor without taking my permission.
I highly appreciate your concern. Ms. Amelia, can I ask, why did you take this medicine? There is any specific reason behind that?
Yes, doctor, as I mentioned, I have got some problems in my personal life, okay, and I have got a lot of stress.
Okay. And how many tablets did you take that time?
Doctor, I kept asking you the same question many times, and obviously you don't care about it. You don't want to answer my question? Why did you involve the mood doctor without my permission?
Ms. Amelia, really, I highly appreciate your concern. We are here to help you and support you, and your health is precious to us. And we need to know, if you didn't take this medicine by yourself, then maybe someone gave you this medicine. So it's important to talk on these issues, because this is a condition. This might take your life even. This is a so dangerous condition.
So
That's why we need to sit together and we need to talk about that, in what happened actually.
okay, doctor.
Miss Amelia, can you tell me, before
Yeah, doctor, please explain to me. Yeah, tell me.
before taking that medicine, did you write anything on the paper, or did you inform anyone at that time?
No, doctor.
Okay. So Miss Amelia, do you have any now you're thinking that you shouldn't be take that medicine at this time?
2 minutes remaining. Sorry, doctor, if you can repeat your question.
Did you have any regret about that? That did you what you have done with your life, with you?
I'm not sure if I got your question, doctor.
I think I'm asking Miss Amelia. Sorry for that. That I'm understandable. Did you have any guilt or regret that you have done with you? You had taken the medicine.
No, doctor.
Okay. So can I ask Miss Amelia, what do you do for a living?
I'm still studying, doctor.
Okay. And with whom you are living?
With my family.
Okay. Do you have any support available at your family, at home?
Yes, doctor.
Okay. So do you have any concern at the moment, except this, that we have invited mood doctor?
You didn't answer my concern, doctor.
Can you repeat me? Sorry for that, Ms. Amelia.
I don't have any more concerns.
Okay. So Ms. Amelia, you were talking about something that you are not happy with some of your events. That's why you have taken this medicine. Can you share with me your thoughts? If you are feeling, yes.
Time up.
Sorry, sorry for that.
Sorry for being rude, surrogate.
No, not a root surrogate. Actually,
yes.
I think I was missing something at that point. So you were trying to reach there, but I didn't reach there actually. Sorry for that.
Exactly. Yeah, I wanted you to say something, but
Yes.
you kept explaining the MDT. However, you need to explain to her that why you didn't invite the mood doctor and why without her permission. Okay.
Yes.
So I will ask you a question. Okay, is it correct to invite the psychiatrist to assess this patient without her permission or not?
You're asking now?
Yes, yeah.
I think yes, sir. We should invite them and we should involve them because already mentioned self-harm case, suspected self-harm.
Okay.
So already done that. We have uh, evaluated gliclazide overdose. So she is not diabetic and she is taking medicine this
Mhm.
at this concentration. There must be a something with the mood problem, and there is self-harm, suicidal attempt
Not
already.
not mood problem, but self-harm. Self-harm.
Yes,
Okay.
self-harm.
If you suspect, okay, not even you have to confirm. If you suspect that the
Mhm,
patient is in danger of or at risk of harming himself or
mhm,
others, okay, you can detain the patient. Okay, sometimes it is called section the patient under the
mhm.
Mental Health Act. Under the Mental Health Act, this detention can be for investigation or for treatment. It can be for investigation or for treatment. Okay.
Okay.
So anyway, detention or yes, it is your right to detain the patient if you suspect self-harm. Okay, and it's your right to invite the psychiatrist. However, this does not mean to go into confrontation with the patient. Okay, you have to speak to your patient to the patient politely, sensitively, explain the situation, explain why you did invite the mood doctor. Okay,
Mm.
and try to gain to gain her trust. Try to build a rapport with the patient. Okay, so let me try to approach the scenario. I enter the session after the usual introduction. Hello there, my name is Dr. Tyro. I'm the medical doctor in the ward today. Okay, is it Ms. Amelia? Yes, doctor. Okay, how do you feel today? It's very important because this patient was admitted to the hospital with acute medical problem. Okay, for the consultation to seem natural, okay, you have to ask her, how do you feel today? Are you okay now? Okay, I'm sorry for what happened to you. Okay, we are here to help you. Okay, and then go forward to take permission for the consultation. We are here to discuss some issues related to your health, if that's okay. Could you please tell me to which extent do you know about the situation? What happened exactly? Anyone explain to you the result of investigation or explain to you anything? Okay, she will start telling you her background. I was brought to the emergency department after I lost consciousness or after I fainted. Okay, I was given some treatment and then admitted to the ward. Okay, currently I feel better and I would like to go home, doctor. So I am glad that you feel better now. Whenever the patient mentions, I improved, I feel better, I have no headache now, I would like to go home, don't proceed with the discussion without telling him that I am glad or I'm pleased to hear that you are okay now or you feel better now. However, I think it is not for you to go home now. It is not safe for you to go home for now. If you allow me, I will explain everything to you. No, doctor, I will not stay. I would like to go home now. Here, obviously, the patient is upset about something. I have to explore why does he want to go home. So could you please share your thoughts around this with me? Can you tell me why you want to go home? Anything we can help you? Anything we can help you with? Doctor, you invited the mood doctor without to see me without even taking my permission. This is totally unacceptable. Okay, this was her main concern in the exam. Okay, yes, actually, she will not understand why you invited the mood doctor if you do not explain the full picture, if you don't explain the diagnosis. However, if you proceed with the discussion and explain what happened and the result of the investigation and so on, she will not be on board with you during the discussion. Her brain will be linked to her concern. Why you didn't answer the concern? She might even become angry. Already she is upset. It is mentioned in your scenario from outside that she is upset and she is asking to go home because you involved the mood doctor. So try to deal with her concern, even if you mention general idea, and then ask her to proceed with the discussion to explain the full picture. Okay, you can say something like, I appreciate your concern. I can see how you are upset about that. Anyone in your shoes would have reacted the same. Okay, Try to allow her some time to express her anger, and then appreciate and acknowledge those feelings. Okay, I appreciate your concern. I can see how you are upset about that. Anyone in your shoes would have reacted the same. Okay, I would like to assure you that everything we did was done in good intentions. Everything we did was done in good intentions, in your best interest. We did this, I mean, we did involve the mood doctor because we had concerns regarding your health and safety. We had concern regarding your health and safety. We were worried about, worried that you might harm yourself. We were worried that you might harm yourself. Your health is precious to us. Try to gain her trust. Okay, in the middle, explain that we invited the mood doctor because we had concerns about your safety. Okay, and everything we do here is for your own sake. It's for your in your best interest and for your benefit only. Hope you understand this point. I'll explain more in a minute. Just I want to know if anyone explained the reason behind your loss of consciousness. Have you got any idea about what could be the reason? Okay, I will ask a question. Okay, no, doctor, please explain to me. So you suffered an episode of severely low blood sugar. I will not tell her hypoglycemia. If I say hypoglycemia, it will be taken as medical jargon, and this will affect the skills C, clinical communication skills. So you have suffered an episode of severely low blood sugar, which resulted in fainting. We did some investigations and workups. Okay, so before telling her or asking her whether she took medicine or not, better to tell her the result of investigation. Okay, tell her how did you confirm she took the medicine first. Okay, so you developed or you suffered an episode of severely low blood sugar, which resulted in fainting. We did some investigations and workups to search for the cause and why this happened. We sent a blood sample to the lab. The result is here with me. It did confirm that there is excess glyclazide in your bloodstream. There is excess blood sugar lowering medication called glyclazide in your bloodstream. Okay, here I gave her the evidence already. No way that she can deny it. It is less likely now the surrogate will deny if you tell her that already we found the medicine in your blood. Okay, so glyclazide is blood sugar lowering medication. Here I will pause and I will wait for her response. What do you think, Ms. Amelia? So here there is two situations. Either she may confess, okay, or she might deny and express anger and so on, regardless of her feeling. I don't know. I don't want to know her feelings. Regardless of her feeling, I will allow her some time to express her feelings, and then after she ventilates her feelings, I will try to gain her trust again. Okay, Ms. Amelia, I am not here to blame you. I am here to help you. I'm sorry for what you have been going through. If you trust me, I will do my best to help you, and so on. Okay, so if she asks you, please, doctor, don't tell anyone about this. Before, by the way, this scenario appeared in the F1 24, but it is not the first time. Appeared many times previously. In one of the scenarios, she took the medicine from her husband. Her husband is diabetic. Okay, so she will tell you, don't tell anyone. Don't tell my husband. Okay, in another scenario, she is a nurse in the same hospital. You will need to raise an incident report, and she will tell you, doctor, please don't tell anyone. Don't tell don't tell our colleagues. Okay, so what do you think? Can you keep the confidentiality in her case?
No.
No, sir.
No. No.
Exactly, but why?
Because it may harm herself again.
Exactly, she's suicidal. She is
Yes.
suicidal. Okay. Anyway, if she's a nurse and working in the hospital, other staff will come to know. They have to know because they are part of the treating team. They are part of the treating team directly involved in her care. So at some point, they have to know. Regarding her husband, if the patient was detained under Mental Health Act because she was suicidal. It was found after psychiatric assessment that the patient is suicidal and she was detained. Before discharge, the psychiatric team will involve the family. They will plan for her discharge. They will do something called safety netting. Okay. For example, they will give them advice. Please, this patient is suicidal. She is at risk of harming herself. Please don't keep any weapon at home. Please close the window all the time. Don't leave her alone. Okay. They have to plan together for the patient's safety. Okay. If they don't know that she is suicidal, do you think this is going to be possible? It will never work, right? So sometimes it's impossible to maintain the confidentiality. Okay, sometimes it is impossible to maintain the confidentiality. However, you need to build a rapport with her. You need to gain her trust. Okay, so that she can feel free and start to speak to you honestly. Okay, like, I'm not here to blame you. Okay, I know you did this because you have been passing through a difficult time. If you share your thoughts around this with me, I will do my best to help you. Okay, your health is precious to us, and so on. Just try to build a rapport with the patient and gain her trust. Okay. So after she expressed her feelings, whether this was denial or anger or whether she confessed, I will allow her to ventilate her feelings. Okay, I will try to gain her trust, and then she might tell you, doctor, I would like to go home. I'm okay now, and I would like to go home. I appreciate your concern. Yes, currently you feel okay, and I am glad to hear that. Currently you feel okay, and I am glad to hear that you are fine now. Okay, but still the level of the medicine is high in your blood. Sorry, someone mic is open. Someone mic is open. Please mute your mic. Dr. Mawadda, please watch out for your mic. So, yes, currently you feel okay, and I am glad to hear that. But still, the level of the medicine is high in your blood. It is not safe to go home now. I will highlight the risk of complications. We need to keep you under observation to make sure that you do not develop low blood sugar again while the medication effect wear out. So whenever someone tells you, doctor, I would like to go home, I don't want to stay here in the hospital, the first step is to explore why. Why do you want to go to the hospital? She might tell you, for example, I have exams. I want to go to my colleague. Here you can offer sick leave. Doctor, I have got kids at home. No one is going to take care of them. Any family member available, any relative who can take care of them? No, doctor. So I will involve the social department. Doctor, it is noisy here. I will speak to the ward manager to try to solve this issue. If it's not possible, we might transfer you to other ward. Okay, so the first step, whenever the patient refuses staying in the hospital, refuse admission, explore why, and then offer solution. However, this is not enough. You need also to highlight the risk of complication. It is not safe for you now. If you go home, for example, you might develop very low blood sugar and then faint again. This might be serious. This might endanger your life because currently still the medication is in your blood. It's in your system. Okay, so I will explore her concern. Why does she want to go home? And then I will offer solution for that. And then the next step, highlight the risk of complication. Highlight the risk of complication and explain also why do you want to keep her in the hospital? If she stay in the hospital, what are you going to offer? Okay, so we need you to stay in the hospital because we are afraid that you might develop low blood sugar at any time because the medicine is still high in your blood. We want to keep you under observation while the medication effect wear out. While the medication effect wear out. Okay? After you give any positive information, of course, you will take understanding. So, doctor, for how long do I need to stay in the hospital? What do you think? How can you respond to her concern? For how long do I need to stay
At
in
least
the hospital?
24 hours.
Will
For
be
at least
there.
24 hours.
There.
This is if you are speaking to your colleague or to your consultant.
We
This
should
is what
not
is
tell
written in the books.
any definitive time frame. We should not do that.
Exactly. Why? For example, in this patient, if the hypoglycemia was severe enough that she received octreotide, for example, you might need to keep her for a longer duration. If you develop complication, for example, irreversible brain damage, you might need to keep her for a long time. Let us assume that the psychiatrist said that she is suicidal and she is at high risk of committing suicidal again. Do you think she will be discharged? No, she will not be discharged after 24 hours. That's why I'm telling you, never give a specific time frame for the patient regarding any question which start by when. Okay, if it is mentioned in your scenario from outside, it's okay. Okay, I will tell her at least for 24 hours. However, this will depend on your response to treatment and how your condition progress. This will depend on your response to treatment and how your condition progress. Okay, so don't mention a specific time frame unless it is mentioned in your scenario from outside. Okay, so here you can take the chance to explain the treatment. Part of the treatment plan is to help you to deal with any difficulties or stress which led to this incident. Part of the treatment plan is to help you deal with any difficulties or stress which led to this incident. That's why we involve the mood doctor. He can decide whether you need any professional help to overcome stress or any difficulties you are facing. Okay, here, before I explain in general that we involve the mood doctor because we had concerns regarding her safety. Okay, we close this issue and I will move to the rest of the discussion. Then when I come to the plan, I will discuss that part of the treatment plan is to help you deal with any stress or any difficulties you are facing. That's why we involve the mood doctor. He can decide whether you need professional help to overcome stress or any difficulties you are facing. He can help you to overcome stress sometimes by just talking to you, sometimes by giving you some medication, sometimes by other form of treatments. This will depend on decision of the mood doctor. I mean the psychiatrist. Okay, clear? So doctor, don't tell anyone, please. Don't tell anyone, please. Okay, let us assume you face the scenario of the nurse. Okay, so I appreciate your concern. I will try as possible as I can to do that. But as you know, people directly involved in your care needs to know. Hope you understand this point, Ms. X.
Doctor.
Okay, yes, tell me, please.
Doctor, I had one of my colleagues, he had the case of paracetamol poisoning. The surrogate told him, don't inform my GP. They wrote it for him in the feedback. Patient asked him not to inform the GP, and he agreed, and then they wrote like incorrect act.
Yeah.
Should the answer be I will inform everyone who's involved in the treatment of this patient?
Not everyone. You can. This is how you can answer in a polite way. I appreciate your concern. We will try to keep all informations confidential when it is possible. However, people who are directly involved in your care, like your GP, needs to know. This is the best answer, because confidentiality does not. I mean, here, if you involve a team member who is directly participating in her care, this is not called breaching confidentiality. If you tell the GP, it is not breach of the confidentiality because he's involved in her care.
Okay.
However, I will not go into confrontation with her anyway. Okay.
Doctor?
Yeah, tell me.
We can involve her family without she is not about her family?
If she's suicidal,
yeah.
Yes, sometimes it can be done. Okay, this is because the law is clear. Law is clear. the Mental Health Act. Okay, if the patient was sectioned or detained, I mean, under the Mental Health Act because she's suicidal, or not only suicidal, even if there is any risk of harming herself or harming someone else, she can be detained either for investigation or for treatment. Okay.
Okay.
Yeah.
And involve her family against her wishes.
Yes, you can do everything against her wishes, but according to the Mental Health Act, they wrote clearly that her freedom should be maintained when possible. Okay, if it was not believed that she is at risk of harming herself, no need to detain the patient. If there is any other way to provide her the treatment without detention, you have to try this way.
Okay, thank you.
Okay, and they will appoint someone, by the way, to speak for the patient wishes. Something called the mental health advocate, to speak about the patient opinions and wishes and so on. Okay, and definitely you need to involve the family members in his care, especially upon discharge. Okay, basically someone who tried to harm himself or tried to commit suicide does not have the capacity. Okay.
Okay, thank
Dr.
you.
Hussam?
Yeah, tell me please.
Doctor, in this scenario, do we need to take the detailed history about the event, what happened before, during, and after,
Exactly.
the risk of suicide?
Thank you for raising this question. I wanted to tell Dr. Azhar actually, no need to assess suicidal risk. Why? Because already the psychiatrist was involved in the issue. Yeah, exactly. This was already done. Okay, since you involved the psychiatrist already and he came and saw the patient, no need. It's not within your task.
Dr. Hussam, it means we cannot ask what happened before, during, and after.
You can.
You lock the door. You write a note, something like that, and.
I mean, these questions are to assess her suicidal risk, right? You will ask about family history of suicide. Did you write notes? Time of the incident, how many tablets did you take, with water or with alcohol, did you lock the door? This is to assess, basically to assess her suicidal risk. And this is why you invited the psychiatrist. You invited the psychiatrist to decide whether she is suicidal or not, whether she's at risk of trying to commit suicide again or not. Is she at risk of harming herself or not? Okay, he is the one who's going to assess the suicidal risk and determine whether we should detain her under Mental Health Act or not. Within this scenario, your main role is to explain this issue to her. This is why we invited the psychiatrist. Is it clear?
Okay. Yes, clear.
I think, okay, we should not ask that question, but I think, do you think any other medication beside this blood glucose lowering agent, we can ask that question?
If she came to you in the emergency department now, okay, you will need to take history. However, this patient already admitted and they did investigation, including blood screen, and already confirmed that she took gliclazide. Don't take history to reach a diagnosis. This is not allowed in communication. Okay.
Assalamu alaikum, doctor. One question, please. Yes.
Yeah, please tell me.
Doctor, should we, if the patient can try to convince the patient about the psychiatrist, the psychiatrist is the best one who can help you regarding your problem in your life? Is it acceptable to say it to convince the patient?
To say what?
The psychiatrist is the best one that can help you regarding your personal life, the difficulties, and check the causes that urge you to do this action and prevent it.
Yeah, this is fine. Just explain why you invited the psychiatrist. Because we had concerns regarding your health and safety. Okay, the psychiatrist is going to assess you, and he can also help you regarding any stress or any difficulties in your life. He can help you to overcome stress, sometimes by talking to you, sometimes by giving you some medication or other form of treatment. Okay, that's why we involve the psychiatrist. He's part of the treating team.
Okay, and can we say also
Okay.
psychiatrists can train you how to deal with difficulties and stress? Educate
Yes,
you how
already
to deal with.
explained. Yeah, already explained this. He will help you to overcome stress.
Okay, thank you, doctor.
Dr. Hassan,
Yes.
it is our protocol in the hospital in such situation to involve the mood doctor to help us. It is our protocol.
Yeah, this is completely fine, but our protocol you should follow this with more explanation. I think you should follow this with more explanation. Why you invited him according to your protocol? Okay, what benefit I will get from following your protocol? Okay, explain his part in the treatment plan. I think this is more reasonable. Do you agree? However, you
Yes.
can mention this. Yeah, you can mention this. No, I don't think it will be a problem.
Yes.
So, yeah.
Dr. Hassan,
Yeah. Yes, please.
If the patient she don't want her husband to know about the incidents, do I need to maintain her confidentiality?
See, as we have explained, if the patient was detained under the Mental Health Act upon discharge, there should be safety netting. There should be a discussion with the family. She doesn't have the capacity. She will be sectioned in the hospital against her will because she don't have the capacity according to Mental Health Act. Upon discharge, you need to plan for the discharge because she's at risk of harming herself again. You have to involve the family members to be able to protect her.
Yeah, I think, but family meeting with her consent, not against her consent.
Anyway, you are not going to go into confrontation with the patient. Okay? I appreciate your concern. I assure you, we will try to maintain your confidentiality as possible as we can. However, I would like to be honest with you. Sometimes this will not be possible because people directly involved in your care, they will come to know. If you say it in this way, she will not go into confrontation with you. Okay.
I have a question.
Our aim is not to reach the point to tell her that legally we have to detain you, and if you go again, we will call the police. No, this is not communication. Got my point? By the way, you can detain her in the hospital by police, but you will never tell her this way in the exam.
Okay, I have a question.
Yes, tell me, please.
Okay,
yeah, tell me.
From the very beginning of my consultation, if the scenario goes in that way, that the patient told me that I'm sorry, it is accidentally I ingest Gliclazide. This first time I never did before. This is the first time, and I am very sorry that I will not do that further. But don't involve the mood doctor.
Okay, I got your question. I got your question. So let us be realistic. Let us deal with the scenario as it came in the exam. In the exam, they invited the psychiatrist for assessment. This means that they did suspect self-harm, and it is mentioned in your scenario. So trust your scenario. However, she didn't say this in the exam. She didn't raise this concern. If it was believed to be accidental, there is no risk of suicide. There is no risk of self-harm. She took it by mistake, definitely. They not mention this in your scenario, yeah.
Okay. On the history, if I asked from who you took this tablet, Gliclazide, if she told that from her house, then
so there is another
house?
Scenario, doctor. Doctor, there is another scenario. Don't confuse yourself, because there is another different scenario appeared previously. In that scenario, you need to assess her suicidal risk. Okay, you need to ask some questions to assess her suicidal risk. However, this scenario is different. Already they mentioned in the scenario that there is yeah.
So in this scenario, this is clinical. Patient has some self-harm issues. I mean, some psychiatric assessment is needed, clinical, but it's for herself or himself. If it is seems to be not injurious for any family member or any other members or any public interest,
okay,
can I just breach the confidentiality? Like, I'm going to talk to your husband or spouse. I mean, if the patient said, okay, don't don't tell my husband or don't tell my wife. In this regard, how should
you
our
mean
approach?
you mean the public is at
I
risk
mean,
because of her?
patient's
Someone is
act
at
is
risk.
completely injurious for himself or herself. She is intended to injure yourself or herself, but not to anyone or any public interest. It's not affecting to anyone. In that
Even
case,
if for her, yes, mental health apply if she is in danger of harming herself or others. In both situations, mental health act applying.
Mhm. But in the I agree at this point. But my question is, in this regard, if the patient said, okay, don't tell me this event to my husband or any family member of mine, should we just retain our his confidentiality or just break this confidentiality?
See, you cannot give her a false promise. Do you agree?
Yeah, definitely I agree. But in the
So let us
treatment
assume.
team,
Okay, let me finish my point. So we will not give any false hope. I'm not going to give her a promise which I will not be able to keep. So let us assume that the psychiatrist detained this patient because he think that she is suicidal. He gave her some treatment and so on. She was stabilized. It is the time for discharge now. He want to plan for her care. He want to do safety netting. They have something called safety netting. He want to discuss with the family to make sure that she is safe at home. Don't keep any weapon. Don't leave her alone. Don't keep the window of the balcony open. Is this going to be possible without involving them in her care? It is not going to be possible. Okay, so at some point they will come to know about the diagnosis.
okay.
That's why I am telling you, if the patient is detained under Mental Health Act, he lost his capacity, and at some point his confidentiality has to be breached when it comes to family member or treating team member who is directly involved in his care. So the best answer is, I appreciate your concern. We will try to protect your confidentiality whenever it is possible. However, I would like to be honest with you. Some people who are directly involved in your care, they must know. This is for your own safety and protection. Hope you understand this point, Miss Amelia. Is it clear?
Okay.
Correct me if I am wrong.
No. It's okay, fine. Yeah, I'm
Sorry.
just because the scenario actually mimicking the another scenario, although it's not relevant to raise this. The scenario was like that. Daughter admitted following a single feed due to some excessive drinking, I mean cocaine or ecstasy. In the next morning, her mother was in the meeting to talk about her daughter condition, and daughter requested to the doctor not to disclose the reason of her fit.
I think someone asked about this scenario in the group. Okay, here there is two problems. You cannot lie to the mother. You cannot tell her that we don't know the cause or the reason behind the fit. You know the cause. And also you cannot breach the confidentiality because the patient did not give you the permission and she is 18. She has the capacity. Okay. So here you will not lie to the mother and at the same time you will not breach the confidentiality. Basically, you will refuse to tell her, but in a polite way. You will not go into confrontation. This is communication. Okay, so I appreciate your concern. I acknowledge that you are worried about her health or about his health. Okay, I can see, or I understand that you, as a mother, you are protective. You feel protective about your son. However, he is a grown man now, and he has the right for his privacy to be protected. He is a grown man now, and he has the right for his privacy to be protected. What I can tell you now is that he is in a good health. So I will avoid speaking about the cause anyway, because let us assume I said, yes, we know the cause, but your son said that he don't want you to know. Here you create a problem, right? You are creating a conflict between the mother and her son. She will go and create problem with him. She will fight with him, right?
Yeah.
So the best way to deal with this situation, I understand you are concerned about his health and safety. As a mother, you feel protective about your son. However, he's a grown man now. He has the right for his privacy to be protected. Okay, what I can tell you for now, he is in a good health. And then proceed with the discussion. Explain that because you will raise concern about the implications of this fit on driving, because I think in the scenario he was a driver. Okay, explain the issue of driving, that he need to stop driving and notify the DVLA and so on, and notify the insurance company. Okay, and proceed with the discussion. This is I think this is the only way to deal with it.
Okay. Yeah.
And
actually,
sir,
the scenario actually divided into intention. If the intention was not suicidal, in that case, we should not involve the mental act.
Yeah, this was not a
is
scenario. This was not a scenario of suicide. He was partying with his friend in a party, and he took overdose and developed convulsion.
Right.
He was
Okay,
not suicidal. Yes.
Yeah.
Yeah. So just because we are running out of time, I want to discuss another scenario. Scenario of atrial fibrillation, and they want you to discuss apixaban. Okay. So here you need to apply approach for explaining diagnosis and explaining new medicine. Okay. So let us assume I want to explain atrial fibrillation. Just a minute. After I enter inside, I will introduce myself, I will confirm the patient identity, I will agree for the meeting agenda, I will check his background and his eyes and so on. And then I will tell the patient that diagnosis confirmed that you have got a problem called atrial fibrillation. Sorry for the long term, let us call it AF for short. Do you want me to explain to you? Do you know anything about atrial fibrillation, and do you want me to explain to you? Yes, doctor, please. Here immediately I will start by drawing. Let me draw you a very simple drawing. It will help us explain the situation. I am drawing, by the way. Let us assume that this is your heart. It has got 4 chambers, 4 rooms. By the way, chamber is not jargon, okay? It has got 4 chambers or 4 rooms. Here, there is a spot. I will draw a spot here. The name of this spot is the SA node. It is responsible for generating the electricity of your heart. In people with atrial fibrillation, there is multiple spots in the heart generating electricity at the same time. This will cause problem with the electricity of your heart and result in your heart beating abnormally, resulting in manifestations similar to your problem. In this way, by just drawing, you will find that you did explain the anatomy. She knows the heart, the 4 chambers, the SA node, and also you did explain the pathophysiology. Instead of only the SA node, there is multiple spots generating the electricity at the same time. And that's why there is problem with the electricity. And that's why there is abnormal heartbeat. So she understands the pathophysiology, resulting in manifestations similar to your problem. She understands that she had abnormal heartbeats, maybe breathlessness, whatever the symptoms she has. She experienced those symptoms. Maybe I think in the scenario developed TIA. Okay, so you did explain the anatomy, the pathophysiology, and the clinical picture. I will move to explain the complication. Because the heart is not beating abnormally, and the blood is not getting out of the heart normally, there is a chance of clot formation inside the heart. Okay? This clot might travel everywhere, causing problems in the body. In your case, it resulted in a mini stroke. I'm sorry to tell you that this can happen again. You can develop another mini stroke or even major stroke. I'm sorry to tell you so. So I will explain by drawing the anatomy and the pathophysiology and the clinical picture. I will highlight the complication, cause if mentioned in your scenario, and then I will highlight the complication before I suggest the management plan. I will highlight the problem, and then I will offer the solution, right? So I'll highlight the complication, and then offer the management plan. For that, our consultant suggested the need for treatment and a management plan. What kind of treatment, doctor? I'll explain the team of care and place of care and so on. And then I will move to the medication, to suggest the medication. So our consultant suggested the need for a medication. The name of this medication is apixaban. Our consultant suggested the need for a blood thinning medication. The name of this medication is apixaban. Whenever you suggest a new medicine, there is a specific information you need to tell to your patient. Why we need the medicine? Why we need the medicine, and what if not taken? So we need this medicine to prevent the development of clot. I would like to highlight that this medicine is not to treat the atrial fibrillation. It's not to treat the abnormal heart rhythm. We need it to prevent the complication, to prevent the development of clot. Without this medicine, you are at risk of developing another TIA or even stroke. And this might be dangerous. It might affect your health. It might put your life in danger. I'm sorry to tell you so. Then I will move to how to take the medicine and when to take the medicine, and if there is any special side effect and side effect and special precautions. Side effect and special precautions. So what do you mean by special precautions? I mean any advice or action. Any advice or action you need to tell to the patient to prevent the development of side effect. For example, I'm prescribing warfarin. Okay, warfarin has got drug-drug interaction, right? And has got drug-food interaction. For drug-food interaction, the action plan is to involve the dietitian. He will give the patient advice and fact sheet and so on. Please don't eat this. This is safe. This is not safe. If you eat this, you will bleed. If you eat this warfarin, it will become less effective and you might develop clot. Okay, so the side effect is drug-food interaction, and the special precaution is to involve the dietitian. The side effect is increased risk of bleeding. Avoid injury is the action you need to take as a special precaution to develop that side effect. Okay, so what kind of special precaution and I can offer to the patient to prevent a side effect if my medicine is apixaban? Any idea?
Chicken with the food.
Avoid non-steroidal anti-inflammatory drug because it increases possibility of GI bleeding with in presence of apixaban.
If she develop any diarrhea and resulting AKI, acute kidney disease.
Avoid contact sports.
Other anticoagulants and regular follow-up of the platelet count and bleeding profile.
Excellent. So I will give you whatever you said is correct. I agree with you. Okay. However, let us be more
even before any minor
well
major
organized.
procedure. Yeah, you should inform your
let us be
surgeon.
well organized, regardless of your medication. Regardless of your medication, you will mention the name of the medicine, okay, and then why you need the medicine, and then you will move to a special precaution, and then side effect, which has no special precaution. So starting with the special precaution, always the first special precaution is the dose itself, dose of the medicine. Okay, so the dose is going to be just sufficient to prevent the development of clot, but it is not going to be high or too high to cause bleeding. So the first special precaution is the dose. It is going to be just sufficient to prevent the development of clot. However, it is not going to be too high to result in side effects. Then the second special precaution is follow-up. Follow-up. We will keep you on regular follow-up to make sure that you do not develop any side effect. For example, if the follow-up involves doing investigation, let us assume I'm discussing warfarin. We will keep you on regular follow-up. We will monitor how thin your blood is. We will make sure that it is thin enough to prevent the development of clot, but not too thin to result in bleeding. So the first special precaution is the dose. The second special precaution is the follow-up. Third special precaution is regarding drug interactions. Please tell any doctor or chemist, I mean pharmacist, tell any doctor or chemist about this medicine before he prescribed you any new medicine. Then, special precaution number 4, you can mention special precaution for drug-food interaction. However, there is many foods which is not safe with warfarin, and many foods which is safe with warfarin or any medication. Okay, so I am not going to go in deep details and mention, for example, please avoid grapefruit, please avoid green leaves and vegetables. No need for this. You have only 10 minutes. So I will involve the dietitian. He will give you advice and fact sheet regarding which food is safe with this medicine and which food is not safe. However, this is going to be relevant if you are dealing mainly with warfarin, because when it comes to NOACs in general, it has got less food-drug interaction, and less drug-drug interaction. However, still, you need to involve the dietitian. Okay, then you can mention, for example, avoid injury and trauma. Avoid injury and trauma because, as we have discussed, this medicine has got increased risk of bleeding. It will increase the risk of bleeding. So avoid injury and trauma. Avoid injury and trauma. Then for NOACs, any special investigation you need to do on regular basis?
Renal function.
Exactly. So we need to regularly monitor your kidney function and liver function to make sure that everything is fine, because this medicine sometimes might affect the liver or the kidney. However, don't worry, I assure you those side effects are very rare, okay? And we will keep you on follow-up as we have discussed. If you develop any side effect, we will either treat those side effects, reduce the dose, give you alternative, okay? We are not going to give you the medicine and that's it. No, we will keep you on regular follow-up. We will keep an eye on you, and we will provide you with the best treatment available, okay? This is how to mention the special precaution and the side effect. Sometimes there is side effects for which you have no special precaution. We can mention them at the bottom and then assure the patient that those side effects are rare and don't worry. If you do those side effects, we'll treat you, or we will give you alternative medication, or we will reduce the dose depending on which medication you are dealing with. Is it clear?
Yes, sir.
Clear.
Yes, okay. Any other question regarding this scenario?
Dr. Hussam, Assalamu alaikum.
Walaikum assalam wa rahmatullahi ta'ala wa barakatuh.
If she is a patient female and can we give her importance?
Yeah, thank you for reminding me.
And advices for pregnancy.
Exactly. So regarding warfarin, it's contraindicated in pregnancy. Okay. However, regarding apixaban, it is classified as class B. Okay, I mean it is safe in animal studies, but no sufficient data for humans. So it will be used in certain situations, okay, but after calculating the benefit and risk. Okay, so still from a point of communication, you need to ask about pregnancy, okay? And you need to tell her that pregnancy should be planned with the woman doctor and so on, okay? Because it does increase the risk of bleeding during pregnancy minimally. There is no sufficient data. Okay, it is class B.
Also OCP.
However, for the purpose of communication, you need to plan the pregnancy with the woman doctor full stop. Regarding OCP, what interaction you mean?
Yeah, interaction with OCP.
No need to ask. Yeah, no need to ask specifically for OCP. However, as we mentioned, you can tell the patient that please tell any doctor or chemist that you are taking this medicine before he prescribed you any other medication. Okay.
Okay.
Okay, so if no more questions, we will stop here. See you next session, inshallah.
Doctor,
And good
just a
night.
quick question.
Tell me, please. Yeah.
There's one scenario of amiodarone and lung fibrosis. The patient was not involved. She developed fibrosis and she was not informed that this was going to be a complication of the disease. Should we also treat this communication station as uncertainty?
So regardless of which scenario you are talking about, I will give you a very simple trick. Okay? If it is mentioned in your scenario from outside that no one informed the patient about anything, take it immediately as medical error. However, if it is not mentioned in the scenario, you enter the station, the surrogate, during the discussion, doctor, no one informed me. Here, take it as uncertainty. Okay, I assure you that in our practice, we do tell the patient about everything regarding the medicine benefit as well as side effect. I will highlight the issue of autonomy here in front of the examiner, so he will give me the full mark within skill E, the clinical judgment. However, let me check with my colleague. Okay, let me go over your notes, and then I will get back to discuss the issue with you further, full stop. So it will depend on whether this is mentioned in your scenario from outside or not. Okay. Okay, see you then. Good night.
Sorry, doctor, one last question for this uncertainty.
Sorry, Dr. Really, I'm running out of time. I have to go now, but please write it in the group. I will respond later, okay?
Okay.
Sorry, I'm really in a hurry.
No, it's okay. It's okay. Thank you so much. Thank you.